Welcome, Curious Minds. Today, we're jumping right into the latest financial pulse from Elevance Health.
That's right.
We're looking at their brand new second quarter 2025 earnings. These just dropped today, July 17th, 2025.
Hot off the press.
Exactly. We've got the official earnings presentation, the full press release, and we even looked back at their Q1 earnings call to really give you the full context.
The Citadel story.
Our mission today, it's really about sifting through all this detail, these financial documents, to pull out the most important bits, the insights, so you can quickly understand what's actually happening with a major player in healthcare.
Indeed. The goal is, cut through some of the corporate speak, give you a clear and concise understanding of where Elevance Health is right now and where they're heading strategically.
Okay.
We'll look at how they're navigating, well, it's a really complex healthcare landscape, isn't it? Focusing on their purpose, they say, improving the health of humanity through these integrated whole health solutions.
All health, right.
So we'll look at the numbers, sure, but also the challenges, the big challenges they're facing and, how they plan to grow long term.
Okay, let's dive right into those headline figures. Q2 2025. Operating revenue came in at $49.4 billion. Now that's up 14.3% compared to last year. Solid growth.
Sounds good on the surface.
Right. But here's where it gets, well, really interesting. Their adjusted diluted earnings per share, EPS, actually dropped to $8.84. That's quite a dip from $10.30 in Q2 of 2024.
Yeah.
And costs their medical loss ratio, the MLR.
Yeah, the MLR.
It increased by 260 basis points. It's up to 88.9%.
Wow, nearly 89 cents on the dollar for claims.
Exactly. They did generate $2.1 billion in operating cash flow for the quarter, and they've returned about $2.8 billion to shareholders so far this year through dividends and buybacks. But that EPS drop and the MLR jump, what's your immediate take?
Yeah, that's the tension right there. What's fascinating is how these numbers, especially that MLR increase and the dip in adjusted EPS, they really signal the underlying dynamics. The company said these results reflect disciplined execution while navigating an elevated trend environment. That phrase, elevated trend environment, that's key.
Okay. Elevated trend environment. And that leads directly to their updated outlook, doesn't it?
It does. That updated outlook for the full year 2025 is a really key takeaway here.
So what's the revision?
Elevance Health has revised its full-year adjusted diluted EPS guidance downwards. Now it's approximately $30.
Down from what they were saying in Q1, significantly.
Significantly. They're also updating their 2025 benefit expense ratio guidance to about 90.0% and their operating cash flow down to about $6.0 billion.
So why the revision? I mean, what specifically are they pointing to?
Well, they're pretty explicit. They point to the ongoing and industry-wide impact of elevated cost trends in our ACA and Medicaid businesses, and also slower Medicaid rate alignment.
So costs are up, and the money coming in, especially from Medicaid rates, isn't keeping pace as quickly as they hoped.
Exactly. But despite these challenges, the CEO, Gail Boudreaux, she emphasized their focus is still on managing healthcare costs, deploying targeted investments in advanced technology and value-based care delivery, and reinforcing the operational foundation. They're still aiming for that long-term goal, at least 12% average annual growth in adjusted diluted EPS over time.
Ambitious, given the current picture.
Yeah.
And quickly on membership, you mentioned mix shift earlier. Total medical membership was 45.6 million as of June 30th.
Right.
And that number reflects growth in Medicare Advantage, which is good.
Always a focus area.
But it's offset by people leaving their Medicaid business, likely due to those redeterminations, and also lower effectuation rates in their ACA plans.
Yeah.
People signing up, but maybe not following through with the first payment.
Yeah, that effectuation piece is important. It's not just signups, it's paying members.
Okay, let's break this down a bit more.
Yeah.
Performance by segment, health benefits, that's the main insurance business. Operating revenue grew, like we said, 11.9% to $41.6 billion.
Still strong growth there.
But the adjusted operating margin fell. It declined by 200 basis points, down to 3.8%. What's dragging that margin down so much?
It really seems to be those primary drivers they mentioned. Higher Medicaid and ACA cost trend. It links right back to that overall revised outlook.
So the redeterminations in Medicaid, the lower effectuation in ACA.
Right. Those things are leading to shifts in the membership mix. It seems like maybe the members remaining or joining are, on average, needing more care, which pushes costs up.
Okay, now let's pivot to Carelon. This is their health services segment.
Right.
And this looks like a completely different story. A real bright spot.
Definitely stands out.
Operating revenue for Carelon just soared, $18.1 billion. That's up 35.8% growth for the segment. Huge.
Massive growth.
And within Carelon Arcs, the pharmacy benefit manager, saw adjusted scripts grow 6.5% to 83.3 million. And Carelon Services, operating revenue expansion over 60%.
Yeah, over 60%. A big chunk of that is the addition of CareBridge, which they acquired, and also scaling up their risk-based solutions.
So connecting this to the bigger picture, Carelon is clearly a strategic growth engine for them right now.
Absolutely. It integrates all these different solutions: pharmacy, home health, complex care management. That CareBridge acquisition, for instance, it's all about providing that high-touch support in the home.
Trying to keep people out of the ER or nursing homes.
Exactly. Helping avoid those really expensive settings, which ultimately should help lower costs per member per month. It's part of that long-term play to manage the overall medical loss ratio.
Now, to really get the full picture of Q2, it helps remember Q1, right?
Hmm.
Just 3 months ago, on the Q1 2025 earnings call, back then, Elevance Health reported what they called a robust adjusted EPS, $11.97. Revenue was $48.8 billion. They beat forecasts.
They did?
And at that time, they actually reaffirmed a much higher 2025 adjusted EPS guidance.
Yeah.
What was it? $34.15 to $34.85.
That's right. Quite a contrast to the roughly $30 they're guiding to now.
It really highlights how quickly things changed, or maybe how quickly the impact of these trends became clear.
It does. It shows just how dynamic this environment is. Back in Q1, the company noted Medicare costs were elevated, sure, but manageable. They saw only a modest MLR impact from flu season, maybe 15-20 basis points.
Okay.
And on Medicaid, they were expecting that tale of two halves for margins. They thought things would stabilize early in the year and then improve later as the updated rates kicked in.
Which hasn't quite panned out as expected, it seems.
Apparently not as quickly, or perhaps the cost trends worsened more than anticipated. The Q1 call also gave some context on the Inflation Reduction Act's Part D changes, explaining it was reversing the usual seasonality for their Medicare drug plans, making earlier quarters look stronger.
Ah, okay.
So all that context from Q1, it really helps explain why the Q2 results, and especially that downward revision, might feel like a bit of a jolt compared to just a few months ago. The anticipated improvements didn't fully materialize yet.
All right, it's a constant balancing act.
Yeah.
So, given all this, what does it mean for Elevance Health's strategy going forward? They talk a lot about whole health, integrating physical, behavioral, social care. How are they actually making that happen?
Well, for consumers, the focus is on trying to make healthcare simple, affordable, and accessible. You hear those words a lot.
Okay, but how?
Practically, it means things like boosting their digital tools to personalize the member experience, designing plans that are hopefully more affordable, and using advocacy and data to improve access. They mentioned their patient advocacy solutions have helped over 6 million members, and they have a 95% satisfaction rate with that.
That's pretty good engagement. And what about for doctors and hospitals, the providers?
On the provider side, the strategy is about deepening clinical and business partnerships. So more collaboration, pushing value-based care models where providers are paid for outcomes, not just volume.
And technology plays a role there, too. You mentioned HealthOS.
Yes, HealthOS. They say it now supports over 88,000 care providers. The idea is to make it easier to exchange information, reduce the administrative headache.
Is it working? I mean, reducing burden sounds great, but does it translate?
Well, they give a concrete example. Prior authorizations. We all know how frustrating this can be.
Definitely.
They say over half of their electronic prior auth requests are now processed in real time. And for providers who perform well, they've actually eliminated prior auth requirements entirely for over 400 outpatient procedures.
Okay, that's tangible. That actually helps.
Right. And it underscores their investment in advanced analytics, not just for efficiency, but also trying to find and cut wasteful spending, improve system integrity. They emphasize a disciplined approach to designing benefits and coding, all aimed at supporting members' clinical needs while managing costs.
So, disciplined pricing, growing Carelon, expanding value-based care. That seems to be the recipe for long-term growth.
That's the plan.
And this ties into their, what they call their long-term growth algorithm. Sounds pretty ambitious.
It is. They're targeting at least 12% average annual growth in adjusted diluted EPS. That's the headline goal.
12% average annual growth. How do they see the pieces adding up to that?
They expect revenue overall to grow at a high single-digit compound annual rate, but they break it down. Health benefits growing, Carelon Services aiming for high teens to low 20s growth.
Wow. high teens to low 20s for Carelon services.
Yeah, and Carolyn Ark's targeting low double-digit growth. They also project their overall adjusted operating margin expanding over time to between 6.5% and 7.0%.
Up from the 3.8% we just saw in health benefits this quarter.
Right, so that implies significant contribution from Carelon and improvements in the health benefit segment over time. And this is all alongside their capital deployment strategy, share buybacks, reinvesting in the business, and dividends. It's a clear roadmap.
The clear but definitely challenging roadmap, especially given the current headwinds they just described.
Absolutely. Execution will be key, especially managing those cost trends in ACA and Medicaid.
So wrapping this up, what we've really unpacked today is a picture of a major healthcare company, Elevance Health, navigating some pretty choppy waters right now. They've had to adjust their immediate forecasts because costs are higher than expected, particularly in government programs like ACA and Medicaid.
Yeah, those near-term adjustments are significant.
But they seem to be really leaning into their longer-term strategy, this idea of integrated whole health, using digital tools, and really pushing the growth in their Carelon segment. They're trying to manage the current problems while keeping their eye on that long-term growth prize.
It's that classic tension between short-term pressures and long-term vision. So what stands out to you from all this? For me, maybe it's that push and pull, like you said.
Yeah, definitely.
And maybe thinking about those industry-wide cost trends they mentioned. If everyone's facing this, what does it mean for healthcare affordability overall? And how might things like AI, technology really change the game? Not just making things a bit more efficient, but fundamentally altering how costs are managed or how personalized care actually gets delivered.
That's a great point. How does value-based care truly evolve from a concept to the default experience for both patients and doctors? Lots to think about there.
Definitely. It's a space that's constantly changing, always more questions to explore.